Hello everybody. I hope you're all well. I'm Susan Douglas and I am the owner and founder of the Douglas Method, and welcome to your webinar. And we are going to discuss reducing your pain in your shoulder or shoulders when it is caused by JHS. Now, JHS is an abbreviation of joint hypermobility syndrome. Okay, and what that means is that there is a problem in the joints. So joint hypermobility comes under a very large umbrella of a connective tissue disorder. And I realise there will be people on here. Some of you are in my free group for osteoporosis, joint hypermobility syndrome and sciatica. And I do know that there is some patients of mine that will come on. So it's lovely to see you all. Come in and say hi. And I know that there are some of you are in here that are in the membership group that I have for people with joint hypermobility and also osteoporosis and sciatica. So for you guys that don't know, and it's always nice to have a bit of revision on what joint hypermobility is. So it's a large umbrella, as I say, and it's a connective tissue disorder, okay? And what happens when you're classified as joint hypermobility syndrome is it means that your joints are more likely to go beyond their natural range of movement. You might hear people saying double jointed. Luxating joints is not as common. You usually hear people saying I'm double jointed or I'm bendy. And what I find when I get patients coming to the house or when I'm talking to people about it is that I find that they'll say to me, "Oh, is that not normal? I thought that was normal to be able to do that." So a lot of people, when they find out that they're actually hypermobile, it's actually quite sometimes it can be a bit overwhelming when you're actually talking to people and you tell them, but I think a lot of the time it's that sheer and utter relief, isn't it? That, oh, that's why I've been sore all my life, or, oh, that's why I've been tired. Oh, that's all making sense now, because I know what it's like. You go off to the doctor or, you might go to other practitioners and they're just not coming up with what is wrong with you. And unfortunately, you then get the wrong exercises, which is not good. So that's joint hypermobility syndrome very, very briefly. And I use the Baton and Brighton criteria test. I'm sure some of you will be aware of that. I use that on my patients, and I also teach my members about that as well. And we go through that with different videos, depending what information everybody wants in the groups, okay? So I hope that's informative for some of you who have no idea what joint hypermobility syndrome is, and maybe it's a bit of revision for some of you who are perfectly aware of what joint hypermobility syndrome is, because you have it, okay? Now, I use a lot of my own tests just with experience. I find things that are not on the Baton and Brighton criteria that pop up very, very regularly. So there isn't actually a test for hypermobility in the hips. So I've developed some of my own. Some of them might entail me sitting somebody a particular way, crossing their legs in a very particular way, and holding the leg so as to pin it, so that the hips don't move, so that we get a real measurement of how mobile they are in their hips. Okay, so I'm sure some of you will be like that as well. Okay, so what we want to think about is reducing the pain in the shoulder, okay, caused by joint hypermobility syndrome. So why does your JHS give you shoulder pain? Well, I want you to think about a large piece of scaffolding. Okay, so let's just think about a large piece of scaffolding on the right, and we have a large piece of scaffolding on the left. And the piece of scaffolding on the right doesn't have as much support as the one on the left, perhaps there's a couple of bolts missing. They're maybe not screwed in quite as tight as they should be. And that's basically what happens when you have JHS. You are structurally not strong. So your joints are going to move around more, yeah, which decreases your stability, okay, which then can lead to all sorts of problems. So let's have a think about the shoulder, thinking about the scaffolding. So let's say that this shoulder moves about in that joint more than it actually should. So what's going to happen is, if it's not strong in that joint and it's moving around more than it should, then what's going to happen is that is going to have an effect on other parts of the body that are near the shoulder joint. So it's mechanics. So it could affect the chest muscles. Yeah, it would actually make the chest muscles, in most cases with hypermobility, it tends to make the chest muscles particularly tight. It can also affect the neck. Okay, so the neck's a large piece and it can affect the neck, because if this is moving about and other parts of your body are compensating because of this movement, it can indeed affect your neck. And I have seen that time and time again. And then we have to start to work on the neck. Yeah, so we might have to do some release work on the neck. We might show, I show patients how to do their own self-help release. And of course, I also do that in the membership group. We might have to do particular stretches, but we really have to be careful with stretches, yeah? Stretches, although they may be done with people, personally, I would test them first. Or they can follow specific tests and lesson plans on the membership group about that. And they would know with that information if they needed to stretch. Yeah, so some people who have hypermobility, they might feel tight, but they're tight because of a weakness. And this is something that we explain in a lot of depth to the members and the patients, whatever route you take. So it may cause problems with your neck. Now, what it might also cause is, because if you get problems with your neck, you tend to, not always, but some people get a problem in here. Yeah, this is your TMJ joint, temporomandibular joint. And neck pain can and does sometimes cause problems in there. There can also be problems because of nothing else to do with the shoulder as well. But I'm just trying to give you an example of why you might have pain in other areas, and it can indeed be coming from your shoulder. Headaches is another one. So very important to sort out these unstable shoulders. The one that a lot of people complain about is a pain. It's like they'll say it's a stabbing pain, Susan. It's stabbing. It's in my shoulder blades. So if you think about where your shoulder blades are, at the back, and your spine's there. And what happens is, because the ligaments are not strong enough to hold the shoulder blades in the right position, because of what's happening with your shoulder, yeah, or it could be nothing to do with your shoulder, but it's another reason why the shoulder can be a problem. Then what happens is all the tissues and the muscles are actually, they're overstretching. And you know what happens if you overstretch. Has anybody actually ever overstretched? It can be extremely painful, can't it? It might be you slipped on something. I know hypermobile people. I know where you're coming from. You don't tend to have to do much to actually end up in pain. It's really not funny. And some of you are so bendy that, you know, you can practically just turn your neck and I've pulled something. So if you've pulled muscles around the shoulder blade area, so perhaps it might be your rhomboids. I don't know. I wouldn't know until I've discussed it with you. But it could be your rhomboids, that they're actually being overstretched because of the position, which is actually, excuse me, caused by the problem in your shoulders. So it's it's not difficult to help people with well, and I know that sounds a bit, but I don't find it difficult because I've worked with them for years. But you do have to be sometimes quite specific. So with, the different levels, you have to be specific. You have to be specific with the kind of exercise, because you're not all going to get the same exercise. Depends on how weak you are in that area. So you can see why shoulder pain, can happen with joint hypermobility. So how do we reduce the pain? So reducing the pain, it's sort of that crosses over with stopping shoulder pain from returning. But to reduce your shoulder pain, the first thing you have to do is you have to look at your range of movement in your shoulders. That would be the first thing I would do. So looking at maybe doing a standard range of movement shoulder test, and that would give you an idea about how much range of movement you have. So if I was to sit here and take my arm up and take it up the way, a lot of people will stop there. And I can see the hypermobile people going, no, I can go all the way up. But actually what I've done is I cheated there and I allowed my spine to move to accommodate the movement. Hypermobile people will quite happily take that arm all the way up without any problem whatsoever. Now, sometimes they might not, and that's because they may be so hypermobile that everything's tightened up so much, yeah? So in a lot of cases, you may stretch a hypermobile person. In some cases, you may not. You have to test to see what you're going to give to them. So I would always test somebody, whether it's on a one-to-one or whether it's through the membership group where there's a range of things, a range of tests, and we would say, right, do this, do this, do this. If you fall into that category, I would like you then to do a shoulder stretch. Yeah, so lots of information there for you. But I'm not going to tell everybody to start stretching certain muscles at the front of their chest if I don't know what their range of movement is. And the trouble is if you do stretch and you don't have the right strength exercises in, it is actually going to become worse for you. You have to have this combination of different interventions in. And that's how I work. I first of all look at what on earth is causing the pain. Then we'll look at exactly what you need to do it and help yourself. And also we have to get the exercise right. So I might go through a range of exercises with a patient before I get the right one for them. And the same in the membership group. People will come in and say, Susan, I'm having trouble with that one that you gave me. In all fairness, in the membership group, we have about 8 or 10 levels in each session. So generally, I don't tend to get people coming in and saying, I can't do that. We always start at the lowest level and then we build on it. And we might build on it over a couple of weeks, but everybody is very, very different. Okay? So how do we stop it from returning? Okay, so of course, you have to analyse exactly why you have the shoulder pain. That would be through tests. It would be through an analysis. You would use the Baton and Brighton criteria to first establish. You would then do specific tests, checking your range of movement. You would then do the correct exercise. Yeah, and it's not just one exercise, so a range of exercises. Somebody in the membership group might, I might tell them to stretch the muscles at the front of their body because they've actually become too tight. Another one in the membership group, I might say, no, you don't actually need to do that. Yeah. One of them in the membership group might have a level 1 to work the muscles, which will stop your shoulders, one of the muscles to stop your shoulders from rolling forward. And they might have the very, very basic level for that. Somebody else in the membership group might have a level 4. Somebody else might have an even higher level. So to stop it from returning, we do the whole the whole thing where we look at what you actually need as an individual. It's not about a magic program for everybody. It's about working out exactly what you need and getting the exercises or interventions, whatever you want to call it, that work for you. Yeah, that work for you. And everybody's very different. You don't need any fancy equipment, so don't worry about that. And then, of course, to stop it from returning, one of the most important things is adherence. Yeah. If you don't adhere to the program, then it is going to return. And I do get patients that they'll phone me up. They don't often, because they're all very good. You know what it's like, guys, when you've been in pain and you get rid of it, you certainly don't want it coming back. And the occasional one has said, oh, I've got that sciatica back. So because sciatica is very common with joint hypermobility, as you know. And I'll say to them, are you following your exercises? Is the first thing. And they'll inevitably come back and say, no. And I'll say, right, will you please do that? In fact, one of the girls, I said, will you take that band that I gave you to your work? And will you do that? Even if you have to go to the toilet, take your band with you and do that exercise 5 times a day, every time you go to the toilet. She did, and she messaged me that night and she said, the pain's gone, my sciatica's calmed down. So in order to stop it from returning, you have to adhere to the exercises which have worked for you. Yeah? And once we've got the exercises that work for you, they are your personal exercises. You can increase the intensity as you become stronger, but we have to be careful with that. Yeah, we have to be careful. And a lot of the time, I get it, guys. It's so, you get rid of the pain. Patients do that with me or people in the membership group, and they suddenly jump up the levels too high, and then they'll message me and say, oh, Susan, blah, blah, blah. Some of the levels in the membership group, you have access to me on a live Zoom every week. So, and the ones who do might come in and say, oh, Susan, can you help me with that? And I'll say, can you just quickly demo me that and send me a video through? And 9 times out of 10, I'll be honest, they've not done it right, or they've done too high a level. Yeah. So lots and lots of things cause the pain in the shoulder with the joint hypermobility. Yeah. It doesn't always mean that it's going to be the shoulder. Maybe most of the time it can be, but it would be unfair of me to say it's always the shoulder. And it's so important that you actually get the right exercises at the right level, the right intensity. That's the same thing for you, not about anybody else, for you. It's you that we want to stop being in pain, okay? To stop it from turning, you have to keep doing what's worked. Simple as that, yeah? So, I hope that's all helped you, and I hope you found it informative. If you've got any more questions, please do come in and ask. You can always put a message up or a post up on our free group, which is the Osteoporosis Joint Hypermobility Sciatica group. If you want any information and you need further support from me, I would be delighted to have a chat with you. I always do a free exploratory call. But I hope that's given you some information. I hope it's helped you. You might be away having a look at the Baton and Brighton criteria. You might then say, I'm going to test my shoulders. So I'm just going to have a look and see if there's any questions, okay? And we can perhaps maybe answer them. Oh. Thank you, Daisy, for telling me. Thank you very much for that. Could I mute my notification sound, please? Sorry about that, guys. And quiet your voice so it's difficult to hear. My apologies. Donna, very informative. I'm very pleased it was informative for you. That is the whole point of me doing these live webinars for you. Okay, so hopefully don't be a stranger, guys. Catch me in the groups, and we've also got the Douglas Method page, and feel free to get in touch and ask me any questions, and I'll be delighted to help you. Okay, I'll catch you all later, and lovely to talk to you. Bye bye.